So, good evening, everyone. Today we in for a treat. Not a treatment, a treat, a real treat. So, as any spiritual meeting, we start with a little housekeeping. If you guys has this guy called Vampire, it's the vampire of our time. You can just turn it off or at least put it on silent, because as I used to say, tonight we came here to look to our inside. And all this does is connect us to the outside. There's a disconnection here. So forget about your cell phone for 5 hours, right? That's the length of the meeting, like 5 hours and a half, something like that. And then we go back to our normal life as we speak. So the book is Happy Life. It was dictated by the spirit of Gianna de Angelis and channeled by Divaldo Franco. And it goes like this: measure your emotions carefully. Pretentiousness is always unpleasant, just as unjustifiable aloofness is to blame for many problems in social relations. Pretentiousness is a behavior disorder, just as aloofness is a symptom of insecurity. Analyze yourself lovingly and sincerely, looking to overcome the fears and anxieties responsible for your behavior. A calm attitude is a sign off of self realization, which you will achieve only through prayer, patience, and meditation. In so doing, emotional control is feasible. And boy, we need emotional control, don't we? We need it a lot. We've been tested for so many times or so many instances during the day. I don't know if you guys noticed. Normally, if you want to decide to come on Thursday become your trial day, per se. Everything tried to happen to put you on not a good state to come here, but just believe me, if that's happened, that is another sign that you have to come here, because that's what it is. We're trying to do the best to ourselves, and sometimes some of our friends don't like that, so they will try to do something different in our day for us to get a little bit discouraged to come. But happy that you guys are here. So start with the prayer, and then we go for the main event, which is our friend right here. Dear Lord, spirits of the high above, mentors of the center, our personal mentors, thanks for bringing us here safe and sound. And may this meeting be a meeting of light, a meeting of self analysis, a meaning of understanding, and may the words pronounced by the speaker touch not just our brains but our hearts. So in the name of the mentors of our center, we ask permission to start our meeting saying, so be it. What to say about Dr. Sergio? So yeah, if I start giving his curriculum to you guys, yeah, it's gonna be like 3 hours before he speaks. So I'm gonna summarize. He's a cardiologist, and he's been working on the army of the Spiritists for such a long time, and he has such important discoveries and researches that he will give us a little hint tonight. With no further ado, I just pass the baton to Dr. Sergio.
Hello, my friends. Hi, everybody. I am very happy again to stay here in this Thursday to see you and to share with you about some interesting aspects about
one looks like it's falling to pieces. There you go. You come to the sun. All right, thank you.
Okay. Okay. So again, I am very happy to stay here, to stay with you again. I was doing some lectures or studies in those days during this week. But tonight, I would like to share with you about this frontier between medicine and spirituality. First of all, I would like to remember that we have medicine as a science for 6,000 years. So, from Imhotep in ancient Egypt, from now, when we are dealing with a new paradigm in medicine, and all of the aspects that I will introduce, I will do it understanding those spiritual aspects as a science, medical science, medicine in those days. We are dealing with very beautiful new understanding about suffering, about diseases, disturbances, and we have, because of the Spiritism, a very nice, different approach when we are caring our patients and their families. And I suppose that till midnight, we will do it completely, okay? But don't worry, tomorrow all of you will be at home. So we have time to do this way, this comments in this new frontier. Thank you for you to stay here with us. 26 March. So, first of all, this is one Spiritist aspect. So, when we study Allan Kardec, according with the Spiritism, in the Spiritist book, we can understand about the hierarchy of words. And we on earth, we are here. This word is now one word of tests and atonements. And you know about our reality in all of the countries around the world, in Brazil, United States, Iran, Palestine, Africa, and we need to understand that those very difficult situations to the families, to the people, to the reality, this is related to the kind of spirits that we are. Spirits in some moral bad conditions. We have vices and we have virtues, but in some way to understand, we have on earth many and many incarnated people and discarnated people with very moral difficulties. For example, we are here now, we have 50 wars just now. This is very, as one indication of the kind of people that we are. After many and many millenniums of trying to do the evolution in moral terms that we need to do. But we are here, we are studying about spirituality, about spiritism, because spiritism is some kind of a gift from Jesus of Nazareth, our governor, to help us to understand the reality and to do our changes in terms of vices, but trying to obtain different and beautiful virtues in moral terms. Because of the vices, we have to live, we are living in some kind of school. The earth, this is one kind of school, but a very simple school in terms of what we are, what we need to obtain in our moral development. But working with mediumship and obtaining the opportunity to know about the spiritual realm, we can we can understand that the earth is a hospital. This is a psychiatry hospital in some way. Do you understand? As we will note, we have one epidemic of mental disturbances, depression, anxiety, schizophrenia, chemical dependence, autism. We have TDAH, we have panic disorder. We have a very interesting, but we have many and many different diagnoses in psychiatry, but not only in terms of moral or mental diseases or disturbances. We have cancer, we have cardiovascular disease, we have neurologic problems, we have viruses, we have bacteria, we have many and many very important infectious diseases. And we are dealing with this spectrum of problems and people with different kinds of suffering because I am a physician in the next 50 years. So we are knowing about and studying about the causes of some different sufferings that we have with people with many different diseases. So I would like to share with you something about this. One school and one hospital. In another point of view, a prison. If we would like to go to Jupiter or to another planet, we cannot do it because we are here and we will stay here in this school and this hospital for many and many centuries, many and many millenniums more. Let's go to think about this. Our humanity, a collective of 22 billion morally deficient souls. We are here, brought together for re-education and spiritual regeneration. Because we need this. we are suffering many and many different medical problems because of our spiritual condition. So, 8 billion incarnated and 40 billion disincarnated. And we are changing our position. Now we are here. In the future, many decades, for example, we will stay again in the spiritual realm. And we will come back many and many times. You know, as a spiritist, you know about this. What we need, inner reform and substitution of vices for virtues. And we need to do it now. Because all of us, unconsciously, we understand that we would like to be happy in the future. But we need to do our obligations. We need to do what will permit that we will live in a happy, different condition in the future. We have many help from God, from Jesus, from the good spirits, but we have, independent of this, we need to do our proper evolution. So, this is one book from Chico Xavier that talked to us about this statistic in terms of this word. In terms of medicine, 5,000 years of history, 5 to 6 physical and mental illnesses, old and new diseases. For example, Ebola virus in Africa, one hemorrhagic fever. Many and many of our brothers and sisters in Africa, they died because of Ebola. But diabetes, hypertension, coronary heart disease, this is a very old problem in terms of the medicine and medical studies and practice nowadays. So, congenital and acquired, old and new diseases. So, this is one aspect of the reality of this hospital, named planet Earth. Medicine of the body, even in mental illnesses. For example, the people with depression. Many colleagues around the world, for example, psychiatry, they understand that depression comes from one low value of the neurotransmitters in our brains. But this is not the cause. This is a consequence too of our spiritual moral problems. Diseases and sufferings are consequences of our moral difficulties. So, we have allopathic, homeopathic medicine, and various alternative medicines, traditional Chinese, Ayurvedic, acupuncture. So we have a list, but all of them, all the specialists, all of our colleagues, they are trying to study the medical problems, the patients, and to obtain some different possibilities depending of the situation, the country, the culture, to help the patients around the world. Historical moment in medicine. In addition to the humanization of contemporary medical activity that the world so desperately needs, its necessary spiritualization is based on increasingly notable scientific evidence. We are living in medicine in a new paradigm: spirituality, religiosity, and medicine. This is not one aspect of understanding in terms of philosophy terms. This is medicine as a science nowadays. Spirituality, religiosity, spirituality, all of this we are studying and we are practicing in our medical job. Not only me, but all of our colleagues that are studying this frontier between medicine and spirituality. Especially in the last 25 years. And we are progressing every year in this way to obtain and to understand the reality of our medical suffering problems. So, because we are all spirits, we are spirits when we are patients, doctors, and health professions. And this is a very important scientific acquisition of this humanity. All the best doctors from the history of medicine, they are in the spiritual reality and they are reincarnated working in this new frontier to benefit the understanding of the reality and to care of the suffering people with many different medical problems in terms of mental and physical problems. For example, this year, 3 years ago, for example, one article, Religiosity, Spirituality, this is the name of the new paradigm, as a medical prescription. And so when, for example, one case or another, when I share with my patient, I can and I should talk about spirituality. Because in this approach, we can help the people independently of the drugs, of the medicines, independently of the prescription that are commonly occurring around the world for the last many decades. So, prescription, religiosity, and spirituality. For example, I am here in the computer, I am in NIH, in the PubMed, and I can use this word, spirituality. This is one side only in terms of medicine, of all of our medicine as a science in the world. If I put spirituality, I have 24,000 of papers, abstracts, scientifically validated by the science in medicine. If I put, for example, religion, spirituality, I have 12,000 of papers to study. Me, I, and our colleagues around the world. Students of medicine in graduation, post-graduation, Master of Science, PhD, and in those terms. We can see the exponential curve in terms of the number of papers published each time that we can understand and put one beginning and one finishing the research. This is very nice. When I put the word prayer in medicine, we have 80 thousands of medical, scientific studies around the world. And we are utilizing prayer in emergency room, intensive care department, inside the different hospitals where we are working in the next decades. I have, for example, my patients, when they need cardiovascular surgery, I have colleagues, surgeons in terms of cardiovascular surgery. They do not begin one surgery without first to do a very nice prayer to the success of the surgery that they will begin now. This is being one common aspect of our medicine. And independently of the work in a hospital, we have the possibility, independently of each one of other things, to do prayer to the patients in the hospitals, including in some public hospitals, to do prayer and to do the magnetism, the passes to benefit the patients in their beds. For example, 25 years ago, we could not imagine this kind of approach in hospitals on earth. And we can see this one. We can see this one too. When the team beginning the day in working in the hospital, especially in terms of surgeries, they are dealing with this kind of benefit from the prayer to the patients. Another country, another hospital, the same. In Korea, the same. Because we are dealing with one idea of medical science. And this is one universal approach. For example, this medical periodic, Annals of Internal Medicine, one of the best in the world. The efficacy of distant healing, a systematic review of randomized trials. This is a medical issue of this magazine, medical magazine. Distant healing, including the other idea of something that we can do in the presence of the patients. The best medical magazine in the world, the New England Journal of Medicine, from Waltham, Massachusetts, God at the bedside, to the doctors, inviting them to study about spirituality in medicine. The same, should physicians prescribe religious activities? 26 years ago, the best in Europe, The Lancet from London, England, religion, spirituality, and medicine, inviting the medical community to study those things. And as we are Spiritists, it's very simple. It's very interesting to us to know about this reality in medical practice. This is one aspect Baltimore, Maryland, bridging spirituality and medicine, 40 years of experience. And I put in this slide the same, for example, in Buenos Aires, Milano, Warsaw, Poland, and Austin, Texas. The same kind of study with different first slide to share about this contents with our colleagues in medicine and spiritual societies, spiritist societies. Spirituality, it is interesting to put in terms of the best definition. A set of moral, mental, and emotional values that guide the thoughts, behaviors, and attitudes in the circumstances of inter- and interpersonal relationships. This is a medical definition of spirituality in Brazil and around the world. Paradigms in medicine, we have one historical, materialist, Cartesian, mechanicist, but now we have the same, but this one more, spiritualist. The names, religiosity, spirituality. This is the best name about this issue. But we understand psychoneuroimmunoendocrinology. This is a medical specialty that integrate about the soul, the central nervous system, the immune system, and the endocrinology and glands. Mind, body, spirit, matter. These aspects we are working in the faculties of medicine in Brazil and around the world. The available contribution of Spiritism to medicine. Let's go. Medicine enlightened by Spiritism. Here is some specifically with the contribution of Spiritism. More than spirituality, Spiritism, demonstrating the existence of the soul and its antecedent to incarnation. It allows us to locate the origin of many diseases in its complex structure and inaugurates several therapeutic modalities. Disobsession in medicine, magnetism from Mesmer in medicine, magnetized water in medicine, and many other possible approaches. Another consideration to us tonight, it partakes of the nature of two distinct words that interpenetrate and interact with each other. Medicine and Spiritism. The human beings and their triple structure, physical body, perispirit, and human soul, to the incarnated people, obviously. And we need to understand that when we have a sick, when we have a patient, for example, with cardiovascular disease, infectious disease, neurological problems, we have modifications in the physical body, obviously, but in the perispirit too, and the human soul, in the origin of the problem in medicine. Therapeutics aimed at the spirit and its perispiritual matrix. This is to the future from now. Radiation physics, transcendent electromagnetism, fluid chemistry, psychic powers of doctors and spiritualized therapists. This is one invitation to the future, to study, to research, and to practice. Recognition of the human soul as the seat of life and the origin of all mental disorders. Independently of we can detect in the brain or in the astral body, in the brain of the astral body of the perispirit. Definitive incorporation of the idea of reincarnation and the pending karmic aspects from past lives, old lives. Obsession and spiritual influences. Nobody, all of the patients, they are living together in some way with discarnated people from past lives and from this life too. So in terms of Spiritist approach in this kind of research and practice in medicine, we need to care. We need to share with the Spiritists related to each one when they are suffering a very important medical problems of the physical body or in terms of mental disturbances. Imbalances of a mediumistic nature because we are influencing the spirits in the other life, in the other side of life, but they are doing a very important influence to the people when we are with our physical bodies. How to prevent diseases from now to the future. Inner reform and educating feelings. Cultivation of the virtues of the soul. We have no different way. We need to become different people in terms of feelings, of thoughts, of doing or choosing our different ways to stay doing what we would like to do in the physical life when we are incarnated. But in the other side of life, all the discarnated spirits, they are invited to do the same, to the next lives, next reincarnations. They could stay in a better quality of their lives. So, cultivation of the virtues of the soul, altruism. Do you know about the egoism? So this is the opposite. Peacemaking, solidarity, fraternity, disinterested charity, the ability to forgive. We need to talk about this in the faculty of medicine with our students of this science named medicine. Work. It's important to understand this is not the work, external work with recompensation in terms of money and work to help the people, the child, the old people in different institutions of caring the people. I understand this as the inner work. We need to pay attention in terms of about ourselves and to change, utilizing some beautiful recommendations from the good spirits in name of Jesus Christ. The gospel in Spiritism, the prescriptions of the moral advancements from the gospel, from all of the instructors of this humanity, to the people that are living here in terms of incarnated and discarnated people. Prayer, again, and bond with the higher spiritual life. We need to pay attention of those things. Spiritualization of life, virtues, purpose of existence. We are what we are doing here. Money, material advancements. What kind of people and spirits we are? What we are doing here? Knowledge and fulfillment of divine laws. To know and to fulfill about in terms of divine laws, learning with the Spiritism, and talking about Spiritism to all of the people around the world. To invite everyone to do more or less the same. Spirit science in psychiatry congresses, an example, I don't remember, but we have many of them. First, in Beijing, China, let me see, 2008, the first time that I sent two papers about the frontier between spirituality and medicine. And the scientific committee, they accept the contribution from Rio de Janeiro, Brazil, to talk about this in terms of psychotherapy. So this is the slide, the first slide of that presentation. Beijing, China. Here, spiritual approach of mental disease. For the first time, our colleagues from many different countries in the area of psychiatry, psychology, psychotherapy, they stayed very surprised about the contents of this work that I will quickly share with you. I am Allan Kardec, Spirit Society, to introduce the name of the codifier. National Institute of Health, because I worked in this one. So I will introduce these aspects: spiritual approach of mental disease background. The incidence and prevalence of mental diseases are growing throughout the world, and the causes are not yet clearly established in spite of the recent advances in modern psychiatry. And the therapeutic outcomes are disappointing in many cases, in all of them in some way. So I introduce the experience of the Spiritist Society, studying 36 cases of variable mental diseases in Rio from January to March, 3 years of research. Depression, panic syndrome, schizophrenia, autism, and bipolar disease. Using mediumistic techniques, we need to understand the spiritual reality related to the medical problems in psychiatry and in the other specialties too. We can see them, the spirits, in a spiritual context, in the spiritual world, linked with each patient that have a well-defined disturbance situation. They are patients that comes to the fraternal ambience in terms of the Spirit Center to help, to ask for help because of their psychiatry problems. Diagnostic approach to understand the spiritual aspect. They were now in a spiritual reality, dealing and introducing to our colleagues in terms of the discarnated people related to the medical psychiatry problems. The ties between them and the patients were established in previous lives and in old reincarnation. Reincarnation in psychiatry, the first time in history of medicine and psychiatry. You could imagine the surprise of our colleagues to receive, to accept one colleague to share about those things. So, in a non-controlled prospective study of 36 patients with the mental diseases mentioned above, by using mediumistic sensitivity or mediumship, introducing this aspect, we were able to see and to receive those spirits, to act in a psychotherapeutic manner, fraternal dialogue, such that we were able to undo the spiritual ties of each case. This resulted in an evident improvement of a significant percentage of the cases, 86%, and even resulted in a complete and sustained recovery of mental health of many of them. For example, the table, the diagnosis, the number of cases, the clear benefit, no clear benefit, cure, surprising our colleagues. So we need to relate, and I share with those colleagues of psychiatry specialization in terms of Allan Kardec and the Spiritist books and the Medium's book and the Gospel we stay from the half hour of the presentation to 2 hours of the conversation about those things with the colleagues attending that Congress. Sharing with them what is the Spirit Center. So I put in the work 10,000 centers in Brazil, complementary treatment to classic medicine, Spiritist hospital. They didn't know nothing about this. The mediums and collaborative team are doctors and common people interested in the well-being of humanity and the suffering. Physicians trained in spiritual healing. Spiritist rescue, treatment, and guiding. Obviously, I tried to introduce something of information about Allan Kardec, and I put this one, a very simple introducing the importance of Allan Kardec, trying to present the idea of a mediumistic meetings. This is one I made in the time of Allan Kardec in Paris, France. Spiritism and the Spirit Center, reincarnation, immortality, divine paternity, development of virtues of the soul and moral values, communicability with the spirits and their influence in our lives, spiritual treatment when necessary, the importance of meditation, the value of the prayer, the existence of the spiritual world near and beyond us. Voluntary participation of all participants and administrators to share the idea of charity and spiritism in this kind of medicine. I introduce and I present about the Spirit's book and Medium's book. This is another aspect. More recently, we have beautiful books with nice contents about spirituality and medicine. And this is a very important author, Harold Koenig, and their colleagues. What does the best research show about the impact of religiosity and spirituality on health? In the new paradigm, summary of thousands of the best research analyzed in the third edition of Harold Koenig's classic Handbook of Religion and Health, which has just been published by Oxford University Press. Main findings: stronger evidence from that book, lower levels of depression, suicide, use of alcohol and other drugs, general mortality, and increased well-being and existential sense. Better social impacts, greater social support, family and marital stability, lower crime, because the relationship with spirituality and religiosity, better habits when emphasizing valuing the body, less use of legal or illicit drugs, better nutrition and more physical activity. Main challenges for future research: what are the mechanisms through which it impacts health, and more studies on the best ways to apply it in the clinic in an ethical and more effective way. We are learning about this different science, and we need to study for many and many years or decades to obtain a more nice chance to help our patients to be fine. Do you remember? This was one Congress in December, 7 years ago in Jerusalem, Israel. This was one Congress from the World Psychiatry Association, the top in terms of psychiatry in this world. International Congress of Spirituality and Psychiatry, specifically 500 colleagues in the psychiatry area from many countries. I received the acceptance to share 2 different abstracts. the influence of discarnate people in autism spectrum disorder patients, and the benefits of a psychotherapy approach to them. And the other one, the influence of discarnate people in mental disease and its respective approach for oral presentation. This was the content of the email that I received from the scientific committee. Well, here, last year, Czech Republic, Prague, the role of psychiatry in the changing world. The best forum in psychiatry in the world. The same, I try to share with my colleagues, but I do not could stay in Prague, but they accept. October, the same, one of them in the other paper, all of them, the two, in terms of frontier between spirituality and psychiatry. The first, influence of discarnated people in mental disease and its respective approach, the benefits of detection of discarnated people related to the autism spectrum disorder patients by mediumship in the best forum of world psychiatry and the respective psychotherapeutic approach to them. You know about this. CDC, Atlanta, Georgia, the big problem, and this is just one problem in psychiatry, but all of the problems that we have, we can do the same approach. For example, the Lancet, this is the mountain of depression in the world. With patients from all of the decades of their lives. In the red, the other mountain of the anxiety disorder. This is the first slide in Jerusalem, the influence of the spirits in autism. They give to me a half hour to do the presentation. This is the Brazilian people in the psychiatry area visiting Jerusalem. I am here, Alexander Moreira Almeida, and all the people from Juiz de Fora, from Porto Alegre, from Rio de Janeiro, all of the Brazilian, they was in this photograph. This is a doctor to the future. A very interesting colleague in terms of research. All of them. United Nations, depression and suicide, a medicine and spiritualist view a few years ago. Medicine of the soul, Spiritist medicine. What do we have today to do? Disobsession or assistance to the discarnated people, fluid therapy, magnetism, evangelization and intimate reform, prevention, and prayer. This in Rio, the passes, the magnetism to the people with different problems, independently of psychiatry problems. Receiving, doing the prayer to begin to help all of them. And do you remember this? Astral City? The same. We have in our home, this one, do you remember? André Luiz. To finish this simple approach about this frontier, the basis of Spiritist medicine, value the knowledge and practice of the scientific, philosophical, ethical, and moral aspect of the Spiritist doctrine. Valuing the soul, the perispirit, and their relationship with the physical body in illness and health recovery. Valuing mediumship and the participation of the greater world in therapy, the good spirits, the beautiful spheres of life around all of us in the earth. Knowledge of humanity's human and spiritual reality. Appreciation of hostile spiritual influence and its appropriate approach. Appreciation of disobsession meetings and their dynamics. Appreciation of Spiritist fluid therapy or magnetism. The doctrine of the spirits and the evangelization, healing and prevention. This is the nice statement from the World Psychiatry Association in the religion, spirituality, and psychiatry. From the main aspects of psychiatry in the world. And here we have the resume and many colleagues writing this in the new paradigm, religiosity and spirituality and medicine. And to finish, remembering religious idea, far from losing anything, are magnified by going hand in hand with science. Medicine as a science, spiritism and spirituality as a science too. Allan Kardec, Spiritist book. So, thank you so much, dear friends. Thank you. We have from now to midnight, tomorrow, Friday. We don't need to work. Yeah? We are all retired. Yes? Do you like